I think the collective action that the NPA is taking is premature, unnecessary and detrimental to community pharmacy patients, and I would urge the NPA to reconsider its position and wait for the outcome of our negotiations coming very, very shortly with the CPE, and we'll be announcing that very soon.
Shadow Minister,
Thank you, Mr. Speaker. They've been waiting for months to get the answer on this, and they are indeed advising all of their 6,000 pharmacy members to reduce services and hours for the first time in 104 years. That's never happened under a Labour government, nor the Lib Dems or a Conservative government. It's this government. And the chair of the National Pharmacies Association said the sense of anger among pharmacy owners has been intensified exponentially by the budget, citing unfunded NICs and national living wage increases. So he acknowledges there's potential action. What contingency plans has he taken as the Minister and Department to make sure we keep patients safe if pharmacies close their doors in industrial action next week?
Well, on the point about the NPA, I mean, it's taken us a while to clean up the utter mess that we inherited in community pharmacy. That involved agreeing financial envelopes, getting into negotiations with the CPE. Those negotiations have been very constructive, and I am delighted to confirm again that we will be announcing very soon the outcome of those negotiations. I think what we see here is the Shadow Minister apparently taking the side of people taking collective action in a premature way that is detrimental to patients, and frankly, they would be better off waiting for the outcome, because we on this side are taking industrial relations into the 21st century as opposed to the performative nonsense that we saw for the last 14 years.
Question number 11, Mr. Speaker.
Minister.
Straight to 11, sorry. Excuse me. Running through. I thank the Honourable Lady for that question. When someone is detained, family involvement is extremely valuable, and families should be supported to maintain contact with their loved ones. Our mental health bill will strengthen requirements to involve families in people's care. We will require clinicians to involve patients and their families where possible when developing new statutory care and treatment plans.
Thank you, Mr. Speaker. I have two ongoing constituency issues with adult men who have serious and long-term mental health issues. One of my constituents believes her life is in danger because of her son's threatening behaviour towards her, and her own mental health has been seriously affected by the fear and stress. The other case involves a young man causing serious distress to his neighbours with his behaviour, which recently led to an incident where he reportedly threatened a police officer with a knife. Both men are living alone in unsupported accommodation. Both are at risk of coercion and abuse because of their own mental health problems, and both are causing serious distress to their families and neighbours. So could the Minister tell the House whether he is working with other departments to ensure there is more provision available to support people like my constituents to live safely in the community and not cause harm or distress to those around them?
Well, I thank her for that question. I know she has met with my right honourable friend, the Secretary of State, about at least one of those constituency cases. NHS England has asked mental health trusts to review the care of high-risk patients and has published national guidance on the standards of care that are expected. Ultimately, the Mental Health Act is there to protect people and provide the necessary powers to enable clinicians to manage and support such patients, and where possible in the community.
Thank you, Mr. Speaker. Yesterday I met with Essex Partnership University NHS Foundation Trust and spoke about the need to support families of those suffering with mental health issues in Harlow, particularly those with caring responsibilities. Can I ask the Minister to consider how mental health services can better identify and support young carers?
Minister.
Well, I thank him for that question. He'll be aware that we are bringing forward legislation, the Mental Health Bill. A very important part of that legislation will enable family members, when they're chosen as a nominated person, to have powers to request assessment under the Act, challenge decisions and request considerations of discharge in line with the nearest relative powers.
Sarah Smith.
Question 13, please, Mr. Speaker.
Minister.
Thank you, Mr. Speaker. I commend my honourable friend for her dedication to improving support for children in her role as the Opportunity Mission Champion. Children with special education needs and disabilities may access a range of NHS services, including health assessments and specialised support. All integrated care boards must have an executive lead for SEND to ensure that this work receives the sufficient focus, and we're working closely with the Department for Education on reforms to the SEND system.
Sarah Smith.
Thank you, Mr. Speaker. As the Minister is aware, sadly last year we faced the devastating closure of the Vic Hospital after 14 years of mismanagement by the party opposite. I want to place on record my thanks to the frontline staff who've managed that transition and the operational challenges to relocate services, but sadly a fully purposed building for children with SEND has had to be used to relocate these clinical services. So how does the Minister plan to ensure that those with SEND are at the heart of commissioning plans and service development?
Minister.
Thank you, Mr. Speaker. The system we inherited has been failing to meet the needs of children with SEND for far too long, and that's become clear with what's happened at Vic. But through the 10-year health plan, we will be considering all those policies, including those impacting children and young people. We're working closely with the Department of Education to support the delivery of the Opportunity Mission, but I also recently hosted a roundtable of children and young people, including those with SEND, so that they can feed directly into the 10-year plan and will be at the heart of our planning and our thinking on these issues.
Thank you, Mr. Speaker. Your heart would have been gladdened last week by seeing colleagues from across the House coming together to support my Down Syndrome Act debate, calling for that Act 3 years on to be implemented. The Minister for Bristol South responded for the government, said that Down syndrome specific guidance would be produced, which was really welcome. So could I ask the Minister to ensure that we now restrict the consultation group to those organisations which represent Down syndrome people only, and promise to the House that after 3 long years that we will finally see this statutory guidance issued before the end of this calendar year?
Minister.
Thank you, Mr. Speaker. I thank the honourable member for his question. Work to develop the Down Syndrome Act statutory guidance is being taken forward as a priority. We have a view to publishing it for consultation by the summer. It is involving people with Down syndrome as well as a wider group.
No topicals unleashed. Midgley.
Topical question number 1, please, Mr. Speaker.
So state.
Thank you, Mr. Speaker. Since I reported to the House on the government's plan to abolish NHS England, hammering the final nail into the coffin of the disastrous 2012 reorganisation of Lord Lansley, the reforms have been welcomed almost universally across Parliament, with the exception of Lord Lansley. I'm pleased to report the new Chief Executive of NHS England, Sir Jim Mackey, has appointed the transformation team that will deliver better care for patients and better value for taxpayers' money. We're working closely together as we finalise the 10-year plan for health, which will be published around the spending review in June.
And Lee Smidsley.
Thank you, Mr. Speaker. My constituent, June, is 74 years old and has stage 4 cancer. She had to queue, not phone, queue at 8 a.m. in the morning at her GP, only to not be given an appointment. Can the Minister tell me what he is doing to stop dreadful situations like this?
Mr. Speaker, I'm very sorry to hear of June's experience. And in fact, this illustrates why our determination to end the 8 a.m. scramble for appointments is so necessary, starting with a new requirement for practices to make online appointments requests available through core hours, as well as the big uplift we've invested into general practice. I hope that will start to see improvements that means people like June will not be left queuing outside in the cold.
So, Secretary of State Ed Agar.
Thank you, Mr. Speaker. And may I just take this opportunity to thank the Secretary of State for his kindness following the death of my father early this month. It was very much appreciated. Mr. Speaker, I welcome moves to streamline decision-making and improve efficiency in the context of his NHS England announcement, and if he genuinely drives decentralisation to ICBs. However, in a written answer on the 21st of this month, the Minister of State stated, and I quote, "We recognise there may be some short-term upfront costs as we undertake the integration of NHS England and the department. For clarity, can the Secretary of State confirm what he has assessed the quantum of those costs of the reorganisation to be and the date by which they'll have been recouped?"
Secretary of State.
Mr. Speaker, I'm sure the whole House will want to send our condolences to the right honourable gentleman following the loss of his father, and it is good to see him back in action, if not always back in action. Look, Mr. Speaker, in answer to his question, there will obviously be, given the scale of the job reductions we're seeking to take and the savings we're seeking to make in the order of hundreds of millions of pounds, there will be some upfront costs. The total quantum will be determined once the final shape of the organisation is determined.
Thank you, Mr. Speaker. Can I also join with the Secretary of State in welcoming, as I did in January, his commitment to seek to work cross-party on the future of social care. He was right, and I welcomed that at the time. But like him and many others, we're all keen to see progress. Can he just update the House on when he anticipates the cross-party talks postponed in February will be rescheduled to take place?
Yes, I'm grateful to the Honourable Gentleman's question. Baroness Casey will be making contact with all party groups in order to set dates with parties across this House very shortly. And of course, she'll be kicking off her commission in April, which is now only days away.
Alan Strickland.
Thank you, Mr. Speaker. It's been brilliant to meet residents in recent weeks who've had their operation dates brought forward, thanks to the additional evening and weekend appointments the Labour government has funded. But we know too many people are still waiting too long. What more will ministers be doing to really drive down waiting lists in my community and across the country?
I'm grateful to my honourable friend for his question. As he says, we've brought NHS waiting lists down 5 months in a row, including during the peak winter pressures. We've delivered the 2 million more appointments we promised 7 months early, and we published our elective reform plan at the beginning of the new year with the Prime Minister, which sets out the combination of measures, the investment and reform that will make sure that we deliver the shorter waiting times and the faster access to treatment that his constituents and people right across the country deserve, and I look forward to keeping you updated.
People in unless we pick up the pace. Helen Morgan will be a good example, Liberal Democrat spokesperson.
Thank you very much, Mr. Speaker. In last night's Panorama programme, the Secretary of State was reported to have said that he doesn't need to wait for a review to put more money into social care, which we agree with. So if that's the case, will he explain why the Casey Commission will take 3 years and instead committing to getting it done this year to fix the social care crisis straight away?
Phase 1 of the Casey Commission reports next year. The final Casey report is due by 2028. But the Chancellor already announced an increase in funding for social care in the budget through means which her party seems to oppose, regrettably.
Mr. Strathern.
Mr. Speaker, it's impossible not to be inspired by my constituent Hayley and the bravery of her daughter Lily after she was diagnosed with an optic pathway glioma, aged just 1. Hayley stepped back from work not just to look after Lily, but to make sure she was able to campaign for change too. Now, the government's commitment to a national cancer plan is welcome, but with brain tumours not typically staged or screenable, how can we ensure they're not overlooked as part of the plan's development?
Thank you, Mr. Speaker, and I commend the honourable member's constituents' work with the Brain Tumour Charity, and I wish Lily well in her treatment. The government has launched the Brain Tumour Research Consortium, which will support efforts to speed up the diagnosis of tumours and aid the recovery of patients, and the National Cancer Plan will ensure that we include brain tumour patients. We know everyone's cancer is as unique as they are, and this will be reflected in the plan.
In reviewing the NHS workforce plan, will ministers urgently review the pay and status of registered nurses, who are, after all, the backbone of the NHS? Many are now dependent on food banks. Thousands are saddled with student debt. And most NHS registered nurses will expect never to rise beyond band 5, which is a maximum of £35,000 a year.
Mr. Speaker, the Chancellor took almost immediate action to deliver the uplift in pay for NHS staff that they deserve. We're working closely with the Royal College of Nursing, Unison and others to make sure we continue to tackle the challenges of low pay in the nursing profession, which the member describes.
Patricia Ferguson.
Thank you, Mr. Speaker. Since being elected, I've been contacted by a number of constituents registered with a GP in Scotland who find themselves unable to get medication for which they have a prescription while they're visiting in England. Will my right honourable friend take steps to encourage NHS England and NHS Scotland to work together to find a solution to the problem that works for patients?
Well, I'm very sorry to hear about my honourable friend's constituents' experience. Accessing vital medicines while travelling between nations should be seamless, and I will ask NHS England to work with NHS Scotland to better understand what needs to change to make things easier for patients across the UK.
Solomon. Thank you, Mr. Speaker. In light of the recently announced 50% staffing reductions across integrated care boards,
Has the Secretary of State made any assessment of how these cuts to the Cambridgeshire and Peterborough ICB will delay the delivery of essential new primary care services for my rapidly growing constituency, particularly in North Stoke, Camborne and St Neots, where thousands of my constituents are already facing unacceptable difficulties in accessing care?
Mr Speaker, despite the significant uplift announced by the Chancellor at the budget system, financial returns during the planning round suggested an overspend for the coming year of between £5 to £6 billion. When I said I wouldn't tolerate overspending in the NHS, I meant it. When I said I would go after unnecessary administration costs, duplication and bureaucracy, I meant it. That's what this government is doing to protect frontline services.
Jenny Riddle-Carper.
Thank you, Mr Speaker. In Saxmundham, in my constituency, Dr Harvard has led a campaign for 20 years to transform the healthcare centre into a one-stop shop community healthcare hub. His practice has already expanded services and in transforming health locally. Does the Minister agree with me that the Saxmundham Healthcare Hub is an excellent example and model for what this government is trying to do to transform community healthcare?
Minister.
Well, I thank her for that question. She's absolutely right that shifting from care from hospital to community is at the heart of our 10-year plan. I'd be happy to meet with the doctors leading this pilot to find out more about the excellent work that she describes.
In Jardine.
Mr Speaker, for 8 years I've seen how a young constituent was able to completely control his previously life-threatening seizures with medicinal cannabis, but at huge cost to his family, cost which makes it prohibitive for other people. So will the Secretary of State meet me to discuss how we can make access to treatments like this more affordable, more accessible and safe to help more people?
I thank you for that question. We recently had a very helpful debate in Westminster Hall on this issue. We are doing more research into this issue to make sure that the evidence base is there. I'm happy to discuss that further with her.
Mohammed Jassin.
In the ongoing discussion on assisted dying, one point on which we all agree in this House is the urgent need to improve palliative care. I therefore welcome the government's recent commitment of 100 million to support hospices, which help my constituency as well. But what can the Minister confirm whether long-term funding for hospices will be a priority of upcoming 10 years health service plan?
Minister.
Well, I thank him, and he's right. The hospice sector has been provided with the largest capital spend in a generation, £100 million. We're also providing £26 million revenue funding to children and young people's hospices, and I can confirm that hospices will play a key role in our shift from hospital to community, as he set out in his question.
Victoria Collins.
Speaker, tragically, Ed was just 24 years old when he decided to take his own life, and that is why the family have joined us today in the gallery. What urgent action are the government taking to improve mental health care and suicide prevention for young people just like Ed?
Minister.
Well, I thank her for that question, and she raises a very important issue. We are investing in 8,500 more mental health specialists as well in every school, and Young Futures hubs across the country to ensure that we do whatever we can to prevent these tragedies happening.
Marcus Campbell-Savers.
Thank you, Mr Speaker. An early day motion from 2007 noted that women were typically waiting 8 years to be diagnosed with endometriosis. Shockingly, nearly 20 years later, that wait has increased to 9 years. This government is right to tackle the appalling waiting list for surgery, but the 1 in 10 women who suffer with endometriosis often struggle with years of pain before surgery is even suggested. Would the Minister outline what plans the department has to deal with these delays and how we can ensure that those working in primary care recognise this debilitating condition earlier?
It's a shocking, those statistics are shocking. I mean, campaigns led here and elsewhere have helped to raise the awareness. Nice guidelines updated will help. Our more appointments and our commitment to 18 weeks will also help. Training for GPs is now part of the core curriculum. We expect that to yield good results. There is look across NHS England with the ONS on the statistics with regards to diagnosis metric standard, and I'm happy to update him outside of this, and other members I know are very interested in how we make sure we deliver on these commitments.
Thank you, Mr Speaker. My constituents in South West Hertfordshire remain concerned about the significant delay to Watford General redevelopment. With the Chancellor already bringing forward a second emergency budget for the House tomorrow, and with care homes, hospices and charities facing unsustainable pressure from this government's national insurance increases, what reassurances can the Minister give my constituents that the Labour Party truly cares about healthcare rather than scoring political points?
Secretary of State.
The irony, Mr. Speaker. Look, there's one big difference between what this government is doing and what the party opposite did for 14 years, which is that this government will actually deliver a new Watford General Hospital where the party opposite failed.
Chris Hinchcliffe.
Thank you, Mr. Speaker. Do ministers agree that it is a logical conclusion from the Darcy report that the National Care Service we committed to creating must be free at the point of use because, as Lord Darcy found, as long as the social care system remains means-tested and the NHS is universal, unmet care needs will continue to put unsustainable pressure on our health services.
Minister.
Well, I thank him for that question. Vitally important issue, and the Casey Commission will absolutely be looking about how best to create a fair and affordable adult social care system, including what structural reforms will be needed where health and social care meet, because reform must always be married with investment.
Cameron Thomas.
My general practitioners have consistently restructured over 10 years of constant systemic and economic pressures. How will the Minister convince the Treasury to exempt GPs from the increase to national insurance contributions and show my GPs that they have their back?
Mr. Speaker, it was thanks to the decisions taken by the Chancellor in the budget that we were able to award £889 million for general practice, which is why my honourable friend, the Minister for Care, was able to agree a GP contract for the first time since the pandemic. The party opposite cannot continue to welcome the investment and oppose the means. They have to spell out where they would cut services or where they would raise taxes instead.
Thank
you, Mr. Speaker. My constituent Danielle was diagnosed with POTS last year and found herself unable to get out of bed and unable to speak for long periods of time. She was unable to receive care in Scotland. Specialist treatment does not seem to exist for POTS. What more can we do for people like Danielle, and what conversations has the Minister had with counterparts about establishing specialist treatment in Scotland?
Thank you. In England, it is the responsibility of local integrated care boards to work with clinicians, service users and patient groups to develop services and care pathways that are convenient and meet the needs of patients with POTS. NICE has published a clinical knowledge summary on the clinical management of blackouts and syncope that provides advice for UK clinicians on best practice and the assessment and diagnosis of POTS.
Thank you, Mr.
Speaker. I've twice previously invited ministers to visit Bridlington District Hospital with me to see its much underutilised potential in light of the ongoing challenges facing coastal and rural health services and the newly announced changes to integrated care boards. Can I hope it's third time lucky and extend that invitation once again?
Who's having it? Secretary of State.
Mr. Speaker, we're delighted to receive the honourable gentleman's representations. We'll look carefully at the case he makes and consider visits as diary allows.
Tulip Sadiq.
Mr. Speaker, much to my alarm, the North Central London ICB has recommended the closure of the maternity unit at the Royal Free Hospital in my constituency. The Secretary of State knows the Royal Free well. Will he meet with me to see how I can save my local maternity unit, which looked after me so well when I had gestational diabetes?
Minister.
Thank her for her question. These local services are so important, as she has experienced, for local women. It's really important that these reconfigurations are discussed with local members of Parliament and representing on behalf of their constituents. It is a matter, obviously, for the local ICB, but I'm very happy to discuss with her further.
Daisy Cooper.
Thank you, Mr. Speaker. Following my long-running campaign, I am grateful to the Government for finally updating the outdated Treasury rules that was preventing local health boards from spending more money on keeping city centre GP locations. Will the Government now issue guidance to local health boards and NHS trusts to accelerate the pooling of resources to get more services out of hospitals and onto our high streets, especially given that our high streets need extra footfall right now?
Secretary of State.
I'm grateful to the honourable member for all of the work she's been doing on this issue. She's absolutely right. We do need more integration of services, and we do need to look at where we can share facilities to achieve better care for patients and better value for taxpayers.
Ms. Shaw.
Thank you, Mr. Speaker. The former chair of my local trust in my constituency, Bradford Teaching Hospitals Trust, Dr. Max McLean, has today secured a landmark victory in securing whistleblowing protection for him. Last week there was a non-exec director who marked a year since he was suspended. A third non-exec director has put in another further ET1. There appears to be a clear culture of targeting and witch hunting against the whistleblowers at Bradford Teaching Hospitals Trust. I appreciate the Secretary of State's team supporting me, but can he meet with me given these recent developments?
Secretary of State.
I'm grateful to the honourable member for raising these serious issues. I think there are issues of concern at play here, and she clearly describes a concerning situation for the local community. We do need to look carefully at what's happening here, and my honourable friend, the Minister of State for Health, would be delighted to meet her.
Richard Holden.
Thank you very much indeed, Mr. Speaker. Smile Dental Services serve one of the least affluent parts of my community in Basildon. They are actually looking to expand and provide more NHS dental services. We've come up against a few issues. Would the Minister either himself meet with me and them, or get some officials to come and meet with me and them to see what we can unblock to deliver more dental health services for local people?
Well, I thank him for that question. We're always looking for opportunities to unblock more capacity, and I'd be happy to meet with the honourable gentleman.
Thank you, Mr. Speaker. Coastal constituencies like mine in Bournemouth East suffer significant health inequalities. What is the government doing to address these, and will the Minister meet me and coastal Labour MPs so we can address this issue?
Minister.
Thank you. The honourable member for Bridlington and Wells is right. Coastal communities face unique challenges when it comes to health inequalities, and I will shortly be attending the APPG for coastal communities to meet with him and colleagues to discuss these issues.
Final question, Charlie Maynard.
Mr. Speaker, as the Secretary of State will know, in 2018, £40 million of funding was allocated by this House in memory of Dame Tessa Jowell, who was killed by a brain tumour. 7 years on, less than half this money has been spent. This money is doing no good sitting in a bank. Therefore, will the Secretary of State please commit to spending that money within a decade of Dame Tessa's death?
Secretary of State.
Mr. Speaker, I'm grateful to the honourable gentleman for his question. It gives me the chance to pay tribute to the late great Dame Tessa Jowell, Baroness Jowell, and also the work that's now taking place in her name through the Tessa Jowell Brain Cancer Mission. There have been frustrating delays in getting funding out the door for the purposes for which it is intended. Ministers are looking very carefully at this issue, and we want to make more progress more quickly to make sure that families are not receiving the same death sentence that our late friend did.
Point of order, Dr. Luke Evans.
I'm grateful, Mr. Speaker, for the point of order. Since the 14th of January, I've tabled 15 name-day written parliamentary questions to the department. Of these, 14 have received a holding response, meaning just one was answered on time. A very simple example, Mr. Speaker, was I asked how many times the Minister had met with Community Pharmacy England. I received a standard holding answer 4 days later saying it will not be possible to answer this question within the usual time period. It then took 5 days for an answer to come, which said ministers meet regularly with external stakeholders in a variety of topics, including but not limited to pharmacy. So could I ask the Speaker his advice on what mechanisms are in place to ensure name-day questions are answered in time? And if they continue to be not answered in time, how can I elevate that further?
Well, first of all, I am disappointed they've not been answered, but I am not responsible for ministerial answers. What I would say, I hope the Treasury bench, and obviously the Secretary of State as well, has taken on board the importance of replying name-day questions are called that because they're meant to be answered by that day. So I would say I'm very disappointed that departments may be overworked. If that's the case, maybe we ought to bring staff in from other departments to ensure that questions are answered on time. But I am sure, I know the Secretary of State will have made a note immediately to ensure that they will be answered. Right, let us complete and move on.
See you later.
Right, we now come to the urgent question. Chris Phil.
Thank you, Mr. Speaker. To ask the Home Secretary to make a statement on asylum, hotels and illegal immigrants crossing the Channel.
Minister.
Thank you very much, Mr. Speaker. As the Right Honourable Member is aware, the Home Office discharges its statutory duties to provide accommodation and support destitute asylum seekers through the 7 accommodation and support services contracts. These contracts were entered into by the previous government, commencing in 2019, and are split between 3 providers: Clear Spring Ready Homes Limited, Serco Limited and Mears Limited. Significant elements of one of Clear Springs Ready Homes subcontractors' behaviour and performance fell short of what we'd expect from a government supplier. That is why the Home Office has informed Clear Springs Ready Homes that it must exit arrangement with Stay Belvedere Hotels subcontractor from its supply chain. We will not hesitate to take further action in respect of Clear Springs and its wider supply chain if this proves necessary. We are conducting a full audit of our supply chain. We expect the highest standards from those contracted to provide essential services, and this government will always hold them to account for delivery, performance and value for money. Where there are concerns about how contractors or their subcontractors are discharging their contractual obligations, we will not hesitate to take swift and decisive action. The Home Office progresses matters relating to these contracts with its providers in commercial confidentiality, and I won't give a running commentary, but I want to assure the House that whatever the position with any of its providers, the Home Office remains focused on maintaining continuity of service and ensuring that our statutory obligation is met at all times and has contingency plans in this regard. None of this takes away from our commitment to reduce and cut the huge cost of asylum hotels, which remains our priority. In relation to channel crossings, this government has put forward a serious, credible plan to restore order to our asylum system, including tougher enforcement powers, ramping up returns to their highest level for more than half a decade, and a major crackdown on illegal working to end the false promise of jobs used by gangs to sell spaces on boats. Increased law enforcement action and disruption is already showing some indication of pressure on the business model of the gangs, and we're introducing new powers for law enforcement to use against the vile trade in people smuggling and trafficking.
Shadow Home Secretary Criswell.
Thank you, Mr. Speaker. Last summer, the government was elected on a promise to end the use of asylum hotels. Well, it's now been 9 months. Let's see how they're getting on. The use of asylum hotels has gone up, in fact, by 8,000 since the general election. It hasn't gone down, it's gone up. 38,000, mainly illegal immigrants, are now in those hotels, costing hard-working taxpayers around £2 billion a year. Mr. Speaker, it is completely unacceptable that taxpayers are asked to foot a bill this size. The people living in those hotels broke our laws by coming here from France. France is a manifestly safe country. Nobody needs to leave France. So I have a very simple question for the Minister. When will they end the use of asylum hotels? Now, Mr. Speaker, the government also promised last summer in the election and subsequently to smash the gangs. Well, that promise now lies in tatters. In the 9 months since the election, 29,162 people, nearly 30,000 people, have illegally crossed the English Channel. That is a 31% increase on the same period 12 months before. And in fact, this year, 2025, is even worse. Since 1st of January, more people have crossed the English Channel illegally than any year in history. This is the worst year. It is 38% worse than the previous worst year. So things are getting worse, not better. They haven't smashed the gangs, they have capitulated to them. Now, she mentions returns. Most of these returns do not relate to people who arrive by small boat. In fact, those people being returned who did come by small boat amount to only about 4% of small boat arrivals. So quite how letting 96% of people who arrive stay here is any deterrent, I really don't know. Now, Mr. Speaker, finally, we saw press briefings at the weekend made to the press, not to Parliament, that the government is now considering some kind of offshore removal scheme. Sounds vaguely familiar. It seems at last they have realised some kind of removals deterrent is needed. So finally, will the Minister now apologise for cancelling the Rwanda deterrent before it even started, and as a consequence of that, losing control of our borders?
Minister.
Thank you, Mr. Speaker. Well, I'm not going to take any lessons from a minister who in his last 3 months as Immigration Minister, saw nearly 10,000 people cross the Channel in small boats and is complaining at half of that level that's happened in the last 3 months. I won't either take any lessons from a minister who was in a government that presided over 56,000 people being in hotels, in over 400 hotels at the height of it. We are getting a grip. We are getting a grip of this problem by. We are getting a grip of this problem by starting up asylum processing once more. We inherited a huge backlog because there was a 70%. There was a 70% fall in asylum processing in the run-up to the general election. They left us with a huge backlog, with over 100,000 people stuck without being processed in the asylum system. We're getting a grip of that, but by definition, because of the backlog and the chaos that they left us, this is taking time.
Chris Murray.
Thank you, Mr. Speaker. Did you say Murray, yeah? Thank you, Mr. Speaker. Does the Minister share my astonishment at the Shadow Home Secretary's argument, given that they wasted tens of millions of pounds on accommodation that couldn't be used and billions on hotels? It's unbelievable the state of the asylum system that was inherited. Will the Minister commit to reforming that seriously dysfunctional system, including scrutinising the asylum contracts with the providers when they come up for their break clause next year?
Minister.
Mr. Deputy Speaker, Mr. Speaker, we did inherit a system in chaos, and we inherited a series of asylum contracts that were 10 years long, worth billions of pounds, with a break clause coming up in 2026. So we are looking seriously at what we can do to get better value for public money in these contracts that we inherited. But I have to say that the action on Stay Belvedere Hotels Limited is one example of the work that we are doing to drive better value in the contracts that we've inherited. We won't tolerate the behaviour of subcontractors or contractors who don't provide good value for money, and that is why we have insisted that Clear Spring Ready Homes remove Stay Belvedere Hotels Limited from their supply chain.
Liberal Democrat spokesperson Lisa Smart.
Thank you very much, Mr. Speaker. It's a pleasure to be back in the chamber to hear the Shadow Home Secretary's greatest hits of Conservative failures from the last Parliament, whether that be cuts to neighbourhood policing or the woeful handling of the asylum system under the previous government, in which he was a Home Office Minister. Of course, the Home Office should ensure all asylum accommodation providers deliver value for money, safety and security. But tinkering with contracts won't change the fact that asylum hotels are a lose-lose that eat up taxpayer money and leave local councils and communities to sort out the mess. Picking dates at random, the share of asylum applications that received an initial decision within 6 months fell from 83% in the second quarter of 2015 to just 6% towards the end of the last government's time in office. So when does the Minister think the processing of applications will speed up so that the backlog will come down, so communities like mine will get the use of their hotels back and those granted refugee status can integrate and contribute to our economy?
Speaker, I certainly agree with the Honourable Lady that the Shadow Home Secretary sounds like a broken record, and we're well used to him running that argument in this place. I agree with her also that the key to dealing with hotels is to get the system back up and running from the chaos that it was in. I can tell her that asylum processing at first decision has ramped up considerably, and we are getting through the backlog that we inherited. But there's also, by definition, a huge backlog in the appeal system, partly caused by the legacy appeal, the dash to end the legacy system ahead of the Fantasy Rwanda scheme beginning, which has led to a big backlog in appeals, and we are looking to see what we can do about that now, because it's important that we get a fast and fair system from end to end, and that includes appeals.
Paul Foster.
Thank you, Mr. Speaker. Because the previous government lost complete control of our borders, The Leyland Hotel in my constituency of South Ribble was closed down 3 years ago. Yes, 3 years ago, and used for asylum seekers. There's a chronic undersupply of hotels in South Ribble, in Chorley, in Preston, in central Lancashire. Can ministers please provide an indication at all as to when it will cease to be used as an asylum hotel? I'm asked this question every single week. Thank you.
Mr. Speaker, I want to get out of hotels as quickly as is feasible. I'm not going to name particular dates because that is a pointless thing to do. The thing is that we've got to get through the appeals system and the first asylum processing system so that we can move people through the system much more quickly. We also need to continue our work on returns. We've ramped those up so that there's been a huge increase in people returned, the highest figures for the last 5 years, and we intend to continue with that process.
Chair of the Select Committee, Karen Bradley.
Thank you very much, Mr. Speaker. The media are reporting that the earliest that the contract can actually be broken is September next year. Could the Minister confirm whether that is the case, and what liability does the taxpayer have for a contract ending today that we can't get out of till September next year?
Mr. Speaker, the Right Honourable Lady is talking about the prime contractor, which in this case is Clearspring Ready Homes. As with the other two contractors, the break clauses are with them. We have approval or not of subprime contractors. Stay Belvedere Hotels Limited are a subprime contractor, and we've withdrawn, as the Home Office, we have withdrawn our approval for them to be in the supply chain.
Stella Creasy.
Thank you, Mr. Speaker. The Shadow Home Secretary has a nerve coming to this House and making this argument when those of us in communities who saw the damage for the contract that he managed done to the public purse. Shall we revisit some of those greatest hits? His contract put councils and Clearsprings against each other, pushing up prices, making it impossible for local communities to help those housed there. He caused absolute chaos. I have in my hands one of the letters that his government was presenting to people who were refugees, giving them less than 5 days' notice of where they were being moved, meaning that school places had to be hastily reorganised, children had to be hastily reclothed because of the decisions he was making on public funds. There was absolutely no savings to be made in the way in which he managed the contract. So will my right honourable friend make a commitment and a pledge to all of us who've had to deal with Clearsprings and their chaotic management that when she has the opportunity to renegotiate the contract or possibly even break it for good, she will put public value for money first and not repeat the chaos of the Shadow Home Secretary?
Thank you, Mr. Speaker. We are doing all we can with the existing contracts to drive value for money, and we are also looking to pilot some other potential alternatives to supply.
Friend of the House, Edward Lee.
Under the Refugee Convention, you can automatically deport illegal migrants who come here, but under the Convention of Human Rights, you can't. Now, I had an amendment moved on my behalf in the committee on this subject, a probing amendment, and I'm going to hope, with your permission, Mr. Speaker, to move it again in report stage. I know the Minister can't answer absolutely now, but will she look at this amendment in a constructive spirit? Surely we can all agree that we don't want criminals entering this country illegally.
I certainly agree with the father of the House on that subject, and we had a small but perfectly formed debate, albeit in his absence, on his new clause. I look forward to debating that with him when we get to report stage of the Border Security Bill.
I think I've still got the largest number of asylum seekers in hotels in the country, over 2,000, and have had experience of Clearsprings and Stay Belvedere. It would be really helpful if in the new contractual arrangements there's full consultation with some of those organisations that are working at the front line of supporting asylum seekers, so some of the lessons can be learnt about past performance to improve future performance.
Thank you, Mr. Speaker, and I'm more than happy to meet with the honourable gentleman to talk about his experience on the ground with respect both to Stay Belvedere Hotels Limited and Clearsprings Ready Homes.
Speaker. I hope I'm not the only person here who is utterly depressed by the complete lack of compassion shown by the Shadow Home Secretary, recognising that the people we're talking about are people with stories of their own and have experienced horrors we can barely even imagine. So isn't it right we look at this in a more thoughtful way? Wouldn't it be a wise thing to reduce cost to taxpayer and to help those who will be successful asylum seekers to integrate, to allow people who are asylum seekers to work after being here for 3 months?
Mr. Speaker, those asylum seekers who haven't had their claims processed within a year are allowed, through no fault of their own, are allowed access to work. I'm unconvinced that allowing access to work earlier would do anything but create more of a demand for people to come here.
Mike Tapp.
It's widely accepted across the whole country and in my constituency of Dover and Deal that the Conservatives left us with open borders, 150,000 crossing on their watch, and the opening of 400 asylum hotels, costing our taxpayers £9 million per day. This government has already established the Border Security Command. We've deported 19,000, that's record numbers, up 24% from what the opposition could achieve, and we're bringing in counter-terror powers to take on the smuggling gangs. Does the Minister agree that the opposition should get behind our bill so those counter-terror powers can empower the National Crime Agency to take out the smuggling gangs?
Thank you, Mr. Speaker. My honourable friend is correct that the Border Security Bill before the House before the House and through its committee stage, awaiting its report stage, will create counter-terror style powers which will help us to prevent some of these crossings, to disrupt the sophisticated criminal smuggling gangs that were allowed to take hold across the Channel unabated by the party opposite, so that we can tackle this problem at source by working cross borders with other colleagues in other countries and tackling the people smuggling routes as well as the gangs.
James Cleverley.
Thank you, Mr. Speaker. The party opposite, when in opposition, talked tough about what they would do when they entered government, but as my right honourable friend, the Shadow Home Secretary, has said, small boat arrivals are up, hotel use is up, and asylum seekers are being waved through the system just to make her numbers look good. This all reeks of arrogance and complacency, and we are now seeing the real-world impact. For example, Wethersfield in my constituency, seeing the number of asylum seeker users going up because whilst they talked tough before the election, they took things off the statute books before they replaced them with anything else. So when will she actually come to the House with serious proposals to reduce the number of small boat arrivals that have gone up by over 30% on her government's watch?
Mr. Speaker, the right honourable gentleman says that Wethersfield is now getting more people, but there are still Wethersfield still isn't holding the numbers that his government planned for it to hold when it was open. So that's rather an odd argument for him to use, and I would have thought that he would actually want to support the counter-terrorism style powers in the Border Security Bill if he was serious about reducing the problems at our borders, but it seems that he isn't.
James.
Thank you, Mr. Speaker. Under this government, illegal workplace raids and arrests are up by a third, and whilst this is welcome, we all know from our high streets and constituencies there is still a way to go. So can the Minister confirm that we'll continue at pace on this trajectory to send a clear message that the UK won't tolerate people abusing the asylum system or in fact illegal activity in any form?
Yes, Mr. Speaker, of course we've got to crack down on abuse of our asylum system, but also on the exploitation of vulnerable and desperate people by vicious criminal gangs.
Pete Wishart.
Speaker, during the Asylum Committee proceedings, I said to the Minister that it's only going to be a matter of time before they concoct some sort of Rwanda-style deportation scheme. Even I didn't think it would come so quickly if weekend press reports are to be believed. Can she say these reports are totally not true? And will she now rule out ever implementing a third-party country deportation scheme like the Conservatives did?
Mr. Speaker, I'm not going to comment on leaks.
Thank you, Mr. Speaker. I welcome the decision to close Napier Barracks in my constituency of Folkestone and Hythe, where there have been long-standing concerns about conditions, among other issues. What assurances can the Minister give to my constituents, and also those being held there, that this site will be operated properly until it closes in September?
Well, if my honourable friend wants to talk to me about any of the details, I'd be happy to listen. But clearly, of course, we want to operate the site properly and appropriately until we hand it back to the MOD in September.
Mr. Macbeth.
Thank you, Mr. Speaker. Given the government doesn't believe in sending illegal immigrants to third countries like Rwanda, can the Minister explain how the government plans to deport people who've destroyed their documents as they've come to this country so that we don't actually know their country of origin? Or is the solution to keep those people here forever in hotels or in one of the 1.5 million homes Labour plans to build?
Mr. Speaker, I don't know why I'm calling you deputy today. I don't know whether I've gone back a very long time to when you actually were, but that is so long ago I can scarcely remember it. My apologies, Mr. Speaker. I think that the Right Honourable Lady should remember that the Rwanda scheme was about deporting people for good and not dealing with their asylum claims. That is not in any way what this government would ever consider doing, which is why it was cancelled.
Sure, why?
Thank you, Mr. Speaker. The Shadow Home Secretary can complain all he wants, but whilst he was in the Home Office, 75,000 people crossed the Channel, with thousands housed in hundreds of hotels across the country. A failed Rwanda scheme and a complete freeze on asylum decision-making is the reason costs rose to £9 million a day on hotels. Everything stopped just to send 4 volunteers to Rwanda, and he is responsible for the chaos. Does my honourable friend, agree that the only party in this House that voted for the Border Security and Asylum Bill will be the one that sorts this chaos out?
Yes, I agree with my honourable friend.
Bickersley.
Thank you, Mr. Speaker. We all want to stop the perilous channel crossings that are costing vulnerable people their lives. So what steps is the government now taking to boost further cooperation with Europol so we can smash the gangs who are profiting on the backs of misfortune?
Mr. Speaker, we've put more resource into Europol to cooperate with European partners across borders. We're operationally working across Europe. We have a new agreement with the German government. We have an agreement on sanctions and illicit finance with the Italian government. We've had the Calais group meet in London. We are doing a lot of work with source countries, areas such as Vietnam, not only on returns but on countering some of the adverts which tell lies about the kind of life that awaits those who get on perilous small boats. So across the piece, both diplomatically and operationally, we're working with our international colleagues to try to put pressure on the international criminal gangs and start beginning to close down this evil trade.
Joe Powell.
Thank you, Mr. Speaker. Under the party opposite, the budget on asylum ballooned to over £4 billion, taking 28% of our overseas development assistance for in-country refugee costs, mainly on hotels, against an OECD average of 13.8%, making us a big outlier internationally. So I welcome the commitments on speeding up processing and reducing hotel use. But with the aid budget reducing to 0.3% from 2027, can the Minister reassure me that an ever-increasing chunk of a smaller aid budget will not be spent in country instead of supporting vital poverty alleviation work internationally?
Mr. Speaker, clearly it's important that overseas development monies are used to try to prevent the kinds of flows of people that we've seen with the collapse in various countries, and we will be doing all we can in the Home Office to minimise the spend that we currently take from the overseas development aid budget.
Sir Roger Gale.
Mr. Speaker, you will know that most of the illegal cross-channel migrants come through this country, come through my constituency in Manston at the processing centre. So I've taken a particular interest in this subject. What I have to say is certainly not going to be popular, either on this side of the House or on that side of the House, but neither is it going to be populist. The Home Secretary and I, not together, both visited the Calais area recently. We saw there hundreds, if not thousands, of very determined, very desperate people who are going to risk their lives to cross the Channel. The Conservatives' Rwanda scheme, I believe, and this government's much vaunted smash the gangs will not solve that problem. There is no quick fix. The only solution will be long-term and international. In that context, does the Right Honourable Lady believe that cutting overseas aid is going to do anything other than worsen the problem?
Mr. Speaker, I suggest that the honourable gentleman raises that issue with the Chancellor.
Amanda Martin. Thank you, Madam Deputy Speaker. It beggars belief that the party opposite have the gall to question the actions we have taken as a government in clearing up the mess that they left behind, because they simply stopped doing anything other than wasting £9 million of taxpayers' money. We've returned 19,000 people with no right to be here, with increased border force, and we've increased working with our European allies and our intelligence services. But, Madam Deputy Speaker, there is more to do. It was a mess. And people in our country feel let down and a deep mistrust of politicians. And this is causing division and rumour mills to develop and fester in our communities. Can the Minister tell me what we are doing as a government to rebuild public trust and community cohesion? And does she agree that this should start right here in this House?
Well, Madam Deputy Speaker, I do believe that people need to think about the language they use and the impressions of human beings that they give when they talk about this very emotive issue, which raises a huge concern, I know, and certainly as a government we've got to do all we can to try to reassure people that we can get this system back under control after finding a chaotic mess when we came into government.
Thank you, Madam Deputy Speaker. I recently wrote to the Minister to request the estimated savings the Government expects from the closure of 10 asylum seeker hotels. In response, I was informed that whilst the Home Office publishes data on the number of people housed in hotels, it does not report on the number of rooms occupied. A hotel accommodating people in shared rooms incurs significantly different costs to one in which individuals occupy a separate room. Yet this critical distinction is overlooked. Given that effective policy decisions must be based on clear evidence, will the Minister commit to publishing room occupancy data to ensure accountability and informed decision-making?
I will write to the honourable gentleman.
Rachel Ruskell. Thank you, Madam Deputy Speaker. I can assure asylum seekers they'll be treated with kindness and compassion in my human rights city of York. However, tragically, at our hotel, a mother at full term lost her baby. So I'm asking the Minister if she will give a guarantee that pregnant women will not be moved from hotel to hotel so they can have continuity of services and a safe pregnancy.
Madam Deputy Speaker, that certainly shouldn't be happening, and if she wants to talk to me about it, I'll try to see what happened in that instance.
Dr. Caroline Johnson.
Thank you, Madam Deputy Speaker. Madam Deputy Speaker, a directive from the Treasury reported in the Times appears to suggest that house building by the government will be able to help with the backlog of asylum seekers staying in hotels. Does the Minister believe that individuals who have arrived in the UK illegally should be given access to social housing ahead of British citizens?
Minister?
No, Madam Deputy Speaker.
Chris Webb?
Thank you, Madam Speaker. Back in 2021, the party opposite when in government told the town of Blackpool they would only be using the Metropole Hotel as an asylum hotel for 3 months. They lost control of the borders, drove an asylum system that went into chaos, and we're still paying that price now in one of the most deprived communities in the country. Does the Minister agree with me that we need to close these hotels as soon as possible and give prime real estate, especially in coastal communities like Blackpool, their hotels back to help their tourism industry thrive?
Minister?
Madam Deputy Speaker, we don't believe that it's sustainable to keep hotel use indefinitely, and we are working to close hotels.
Liz Hocking?
Thank you, Madam Deputy Speaker. Small boats crossings are up 30% since the general election. The number of illegal asylum seekers in the asylum hotel in my constituency of Broxbourne is also up. Illegal asylum seekers are being prioritised for GP appointments and school places, which is outrageous to me and my hard-working constituents. Can the Minister tell the House when she will meet her manifesto commitment of closing the asylum hotel in my constituency of Broxbourne?
Our aim, Madam Deputy Speaker, is to close asylum hotels and get out of what we feel is an unsustainable situation as quickly as practicable.
Alex Neville?
I'm sure the Minister agrees with me. The root cause of this crisis was the last government first politically motivated, first slowing down and freezing of processing of asylum applications. I have asylum seekers in my constituency waiting 10 or more years for a decision. Has the Minister considered, because the British public want to see a contribution by asylum seekers to the system, reduce on the public burden on taxpayers, lifting the right to ban of people waiting more than 6 months for a decision until their decision is made, so they can contribute to our tax system?
Madam Deputy Speaker, asylum seekers who wait longer than a year are allowed to work so long as that wait hasn't been caused by them, so wait through no fault of their own. So we have that system now. I'm not considering shortening the length of time which must elapse before that is allowed.
Questions are getting considerably longer and longer. Can we keep them on point? Jeremy Corbyn.
Thank you, Madam Deputy Speaker. Like the member for Herne Bay, I've visited Calais on a number of occasions, and I've met people there who are desperate, victims of war, human rights abuse, environmental degradation and sheer poverty and desperation. They don't cross the channel without some reason to do it. What conversations is she having with European countries, North Africa and the Middle East, about the root causes of the huge numbers of people globally who are seeking asylum at the present time? Inhumanity, deportation isn't going to work.
Well, I don't apologise for deporting people who have no right to be here, who've been through the system and are discovered to be neither asylum seekers or have any right to stay in the country. But I accept the point the right honourable gentleman makes about the desperate situation that people are in. They could claim asylum in the country they are in, and we need to look and work with our counterparts in the European Union and along all of the routes to see what we can do to divert those people who are seeking a better life in our country, and see if we can look after them closer to home.
Yeah.
Thank you, Madam Deputy Speaker. Under this Labour government, illegal working raids and arrests are up by a third. I wonder if the Minister will agree with me that that sends a clear message that the UK will not and should not tolerate those who abuse our immigration system, and that will crack down on illegal activity in all its forms.
Yes, Madam Deputy Speaker. Illegal working arrests and visits increased by 38%. More people have been arrested, more people have been fined. We are seeking to get those who abuse illegal workers, often underpaying them and treating them like modern slaves, banned from running companies, and the fines are now £60,000 per illegal worker. There's no reason why legitimate small businesses should be undermined by illegal working and illegal practices.
John. Thank you, Madam Deputy Speaker. Is the government considering sending failed asylum seekers to overseas return hubs?
Madam Deputy Speaker, I'm not going to comment on leaks.
Tom Hayes.
Thank you, Madam Deputy Speaker. It's always a pleasure to see the Shadow Home Secretary shoot himself in the foot, particularly when he brings a sawn-off shotgun to do the job. On this issue of asylum hotels, the government really is getting a grip with it, and the Conservatives ought to be appalled. We heard in Bill Committee about how children were being targeted for organ harvesting, sexual abuse and going missing into the system. The Conservatives put bills onto the statute book which they never implemented. So I'm pleased that this government has committed to closing asylum hotels, that they've given me the assurance that they won't be adding hotels to Bournemouth. But would my honourable friend agree with me that when the Conservatives in Bill Committee defined a deterrent and they said it was about detaining and deporting, the Conservatives neither detained nor deported, so we should stop calling the Rwanda gimmick a deterrent?
I agree with my honourable friend. 85,000 people came across in small boats from the time the Rwanda scheme was first announced to when it was actually ended.
Richard Ford. Madam Deputy Speaker, last month we learned that overseas development assistance would be cut from 0.5% to 0.3% of global national income. Some of us assumed that this saving would be found from the closure of so-called asylum hotels. But now we learn that the government will be continuing to hire hotels for many years to come in spite of the break contract. The Minister says that she wants to minimise the effect on the ODA budget, but how much of the ODA budget will remain?
Well, currently, ahead of the reductions that were announced, my understanding is that 20% is currently spent on housing asylum seekers in this country. Clearly, if we can get the system running faster from start to finish, if we can get people through the system faster, we can reduce those costs.
Sean Davies.
Speaker, this government inherited a chaotic and broken system and disorder at the border. And under the last Conservative government, a manor house in my constituency was deprived from the community for an asylum hotel use. Can the Minister confirm that it is the hard yards mission of this government to close those hotels and give them back to their communities?
Yes, that is our aim, Madam Deputy Speaker.
Deputy.
Deputy Speaker, I appreciate the Minister's curt responses suggest she's struggling somewhat with her brief, but does the Minister for Border Security and Asylum actually know how many gangs have been smashed? If she doesn't, and I suspect she doesn't based on her previous answers to me, then why doesn't she? And if she does, can she inform the House? Unless, of course, the answer is that no gangs have yet been smashed.
Well, I thank him for his belief in my ability to get on top of my brief. The National Crime Agency have recently arrested 3 men in the UK wanted in Belgium after being convicted for being part of an Afghan OCG. They've arrested a Turkish national suspected of being one of the most significant supply of boats and engines to gangs. He was detained in Amsterdam following a joint operation involving the NCA, Belgium and Dutch police. Convictions of 2 men based in South Wales who ran a people smuggling ring involving moving thousands of migrants from Iran, Iraq, Syria and across Europe in a major international operation involving the NCA targeting a Syrian organised crime group considered one of Europe's most significant people smuggling gangs, which saw at least 20 people arrested in a series of raids across the continent, including one in the UK. This is just what's been happening recently. There's a lot more work going on, many investigations, the fruit of which will be born and we'll talk about when it's delivered.
John Singer.
Madam Deputy Speaker, can I commend the work that the government has undertaken with European countries and others to smash the criminal smuggler gangs, such as the French deployment of specialist units on the beaches and German raids on small boat warehouses, and indeed the efforts of my right honourable friend, the Home Secretary, in Iraq and in the Kurdistan Regional Government in Iraq. So can the Minister confirm that although we will not smash the gangs overnight, the government remains committed to working with our international partners to secure our borders?
We are doing that work day in, day out, Madam Deputy Speaker. If the party opposite hadn't let smuggling gangs take hold across the Channel for 6 years, then we wouldn't be having the difficulties we're having now to deal with them. This takes time. There is no simple, easy solution, and chuntering about it from the opposition front benches, which, let's face it, is where they belong, is not going to make any difference.
Ola Lockhart. Thank you, Madam Deputy Speaker. In the first 9 months, this government, we have witnessed the cruel impact of the government's decision-making on farmers, pensioners, WASPy women, people who have worked all their lives, while taxpayers' money continues to fund hotel accommodation for those economic migrants arriving illegally via the Channel. My constituents in Upper Bann want to see this government put British citizens first, rather than prioritising spend on those who are arriving illegally. What can she say to them today?
It's important, in order to deal with the chaos we inherited, to create a system that's faster, fairer and much easier to get through than the one we inherited. Unless the Honourable Lady wants people to be destitute on the streets, we have to look after them while we're processing their asylum claims. So speed is important here, as well as making sure we do that fairly.
Jonathan Hinton.
Madam Deputy Speaker, and I thank the Minister and her ministerial colleagues in the Department for the work they're doing to tackle illegal immigration, especially the enforcement against the gangs who put vulnerable lives at risk. My constituents in Pendle and Clitheroe want illegal immigration stopped, and the chaotic huffing and puffing from the Conservatives is one of the reasons they were booted out on this issue at the general election. It is so important for restoring faith in politics that we deliver on this. Does the Minister believe that the existing legal framework on asylum and returns will allow us to do this?
The Prime Minister has made it clear that the answer to this is not going to be to ignore international law. Therefore, we have to ensure that we can create a system that's fast, fair, effective, and does the job much more effectively than the one that we've inherited. And we're looking to see how we can make changes to ensure that that is the case.
Shaukat Adam.
Thank you, Madam Deputy Speaker. Everyone agrees we must have a sensible immigration policies, but does the Minister agree with me that terms like stop the boats, smash the gangs are just populist sloganeering, which dehumanises the most vulnerable in our society and serves to scapegoat successive government shortcomings, including the £700 million spent on the useless Rwanda scheme, billions wasted on the PPE, and the lack of investment on the NHS? That's the reason why people don't get appointments with their GPs, not people arriving on a boat. So would the Minister agree we must take a holistic approach, and one maybe is to look at opening up safe routes and efficient processing, so as soon as people arrive in this country, they can start working from day one?
I don't think, Madam Deputy Speaker, that safe routes would stop people trying to get into this country clandestinely. And it's important that we can assert control at the border so that we decide who comes into our country, not the people smuggling gangs.
Luke Meyer.
Thank you, Madam Deputy Speaker. When I speak to my constituents, they accept that the previous government overspent by billions on the asylum system, and it fell to this government to take the difficult decisions to settle the bill. But what they cannot accept is how it is fair that taxpayers continue to be expected to pay £9 million a day on asylum hotels. It was a mark of shame for the previous government. It may become one for us unless it is resolved. What steps will the Minister take to speed up processing, increase returns and end the use of hotels for good?
Madam Deputy Speaker, we've restarted asylum processing. We're looking to see what we can do to speed up the appeals backlog that we've inherited, and we will create a system that is faster, firmer and fairer, so we can get out of asylum hotels, which isn't a sustainable model for the future.
Final question, Jim Shannon.
Thank you, Madam Deputy Speaker. And I thank the Minister very much for her answers to the questions which others have posed. There's a clear differential between asylum seekers, those fleeing persecution, those who are threatened, and those who are economic migrants. So can the Minister please outline how government can get control of accommodation for those who are economic migrants to reduce this horrific bill, taking into account that there are families in my constituency of Strangford and others sleeping on floors in family members' homes because the housing executive who has responsibility back home cannot cope with demand? And how will government and the Minister ensure that families and children are housed whether they are asylum seekers or British citizens? Thank you so much.
Well, my right honourable friend, the Deputy Prime Minister, I think has made some announcements recently about the capacity to increase house building in this country to deal with some of the pressure on demand. And clearly it's very important from an asylum seeker point of view that we get the system working end to end much faster so that we can get people through the system, deport those who have no right to be here and integrate those who've been accepted as asylum seekers.
That's the end of the urgent question. I'll give the front benches a few moments to swap over. So Victoria Atkins.
Many thanks indeed, Madam Deputy Speaker. On a point of order, the head of the Dover Port Health Authority has told the House that if funding is not secured for the new financial year, food security checks at the border will be stopped. On the 6th of February, I asked the Secretary of State for DEFRA to confirm this funding. He did not answer and has not responded to my 2 written parliamentary questions on this. We are now more than 2 weeks past the deadline for a response and days away from the new financial year with no answer on whether these important checks at our border will continue. Madam Deputy Speaker, may I please have your guidance on how to ensure a prompt and accurate response from the Secretary of State before the checks for diseased meats in particular stop?
Very good.
I'm not sure whether that point of order we were alerted to earlier on. It is always good to give prior notice for the exact language within the point of order, but the honourable member, the right honourable member, will know that is not a matter for the chair, but she's put her point on record, and no doubt the front benches, the Treasury benches, will have heard and will be passing on her views. Right. We're now going to go on to the presentation of bills. Presentation of Bill Sir Christopher Chope.
Arm's Length Bodies Accountability to Parliament Bill.
Second reading what day?
Friday the 28th of March.
Friday the 28th of March. We now go on to the 10-minute rule motion. Luke Murphy.
Thank you, Madam Deputy Speaker. I beg to move that leave be given to bring in a bill to provide for the inclusion of economic growth as an objective for certain statutory regulators and for connected purposes. For too long, our regulatory system has been tangled, inefficient, and yet disconnected from the mission of economic growth and prosperity. Instead of fostering investment, encouraging innovation, and delivering good jobs, regulation has too often acted as a brake on progress. Too slow, too risk-averse, and too unpredictable. The previous government hid behind regulators, deferring decisions, creating unnecessary bureaucracy, and allowing inefficiencies to flourish. Too many businesses today face an overlapping, complex regulatory environment with too many regulators, too many conflicting duties, and too little coordination. It is a system that frustrates ambition and slows down investment. And this government is determined to change that. Under the leadership of the Prime Minister, the Chancellor and the Business Secretary, the government are committed to smarter regulation. Regulation that is pro-growth, pro-innovation, and yes, pro-worker. We recognise that regulation, when designed and implemented well, is not an obstacle, it is a tool to unlock private investment, tackle systemic risks, protect the environment, and deliver better outcomes for people and communities. Madam Deputy Speaker, Britain's businesses, large and small, are ready to drive economic growth. But they can only do so if the regulatory system enables them. There are now more than 100 regulatory bodies, many with overlapping mandates and responsibilities. The 17 key regulators the Prime Minister wrote to in December collectively employ 36,000 staff and spend £5.4 billion a year. That is a significant national investment, but one that too often lacks strategic coordination. Instead of working together, many regulators operate in silos, duplicating work, slowing decisions, and creating unnecessary costs and confusion for businesses. Their powers and duties have expanded over time without any overarching framework to keep them aligned. The result? A fragmented, sometimes contradictory system that no longer serves our national economic interest. A clear example is the payment systems regulator. Firms operating payment systems like MasterCard or Faster Payments were forced to engage with 3 different regulators just to function in the UK. That meant 3 sets of rules, 3 sets of processes, and 3 sets of conversations to deliver just one service. For major firms, this was frustrating. For small or scaling businesses, it was a serious obstacle. That's why the Prime Minister has announced its abolition, with its core responsibilities to be folded into the Financial Conduct Authority. This is not, though, about deregulation for deregulation's sake. It's about smart simplification, removing duplication, reducing cost, and creating clearer points of accountability. In short, it is about regulating for growth. But let's be clear, one example isn't enough. The problem is systemic. The entire regulatory landscape needs to be reviewed, streamlined, and refocused around a shared mission of economic growth. That's what the Regulator's Growth Objective Bill delivers. This bill supports the government's broader regulating for growth agenda. The Chancellor and the Business Secretary have now published a radical new action plan, backed by business, to create a more agile, investment-friendly regulatory environment. As part of this work, the Chancellor secured 60 pledges from regulators that will deliver real, tangible change within the next 12 months. The CBI has rightly called it a shift towards more proportionate, outcomes-based regulation. This is practical, pro-growth reform, delivering for businesses, supported by businesses. But we must be clear that regulation can be both pro-growth and pro our other priorities too. Balanced, purposeful regulation can support growth and support the environment, strengthen public trust and raise living standards. Take the government's New Deal for working people. The benches opposite claim that our proposals to raise the minimum wage and end exploitative zero-hours contracts, introduce day one rights against unfair dismissal and expand access to sick pay and parental leave are somehow misaligned with the government's wider approach to regulation. But they fail to recognise that for too long, the UK has operated with a labour market divided between secure, well-paid jobs and a growing share of insecure, low-paid work. The result? A low-wage, low-productivity doom loop. So our New Deal for working people is regulation with a purpose, making work more secure, businesses more productive and the economy stronger. These policies aren't just good for workers, they're good for business too. Madam Deputy Speaker, this government is not tearing up the regulatory rulebook. We are rewriting it for a new era. And we can and must learn lessons from home and abroad. Like Japan's Top Runner programme, a pioneering regulatory approach that sets energy efficiency standards based on the best performing products on the market, pushing industries to innovate and improve. By combining ambitious targets with industrial flexibility, it has successfully driven technological advancement and economic growth, while also reducing energy consumption. Or take the push by UK financial regulators to require major banks to open up their customer data with consent to third parties. This has helped create a globally leading fintech ecosystem, with investment in UK fintech soaring. This bill would force us to ask, how can we repeat these successes in other sectors? Because for too long, regulators have been left without that kind of strategic guidance, forced to make politically sensitive decisions in a vacuum. This is not fair on them, and it is not good for the country. So this bill gives regulators the direction they have been missing. It doesn't ask them to stop doing their work, it asks them to do it better, together, and with a shared focus on creating prosperity. Because when regulation drifts, so does the economy. Yet right now, there is no formal mechanism to align regulators with the government's growth strategy. This bill provides it. It enshrines one simple principle. Regulators must not only regulate for risk, they must regulate for growth. That means every regulator must consider the impact of their decisions on investment, innovation and prosperity. Regulators must work together, ending duplication and aligning around shared national priorities. Growth becomes a statutory objective, not an afterthought. Madam Deputy Speaker, this is not theory, it is delivery. Regulation is not confined to the corridors of Whitehall. Its effects are felt in constituencies across our nation. So this bill is a call to action for the government to bring forward a full review of regulators' duties and objectives, with the ambition of creating a simpler, smarter framework fit for the modern economy. Too many of our regulators are operating under a patchwork of outdated or overlapping mandates. The result is duplication, drift, and decisions that lack coordination or clarity. It's confusing for businesses, it's inefficient for regulators, and it's a barrier to growth. That's why today I urge the government to go further, to begin the work of legislating for a core set of statutory duties, including growth across the regulatory landscape. Duties that promote long-term growth and investment, that protect consumers and the environment, and that embed a culture of speed, clarity and accountability in decision-making. A system where regulators remain independent, but where the expectations placed upon them are consistent, transparent and aligned with our national priorities. We will continue to protect what matters: safety, fairness, the environment and public trust. But we must also deliver on what moves us forward, towards innovation, economic renewal and growth. Because growth is not a luxury. It's how we raise living standards, improve public services and restore pride in every part of this country. So let's give regulators a clear foundation. Let's bring forward a new legislative framework that reflects the ambitions of a dynamic, pro-growth Britain. Madam Deputy Speaker, let's regulate for growth. I commend this bill to the House.
The question is that the honourable member have leave to bring in the bill. As many of their opinions say aye. As many of their opinions say aye. Aye. Of the contrary, no. The ayes have it, the ayes have it. Who will prepare and bring in the bill?
Luke Charters, Uma Kumaran, Lola McAvoy, Chris Curtis, Sonia Kumar, Gregor Poynton, Kanishka Narayan, Mike Reeder, Polly Billington, Rachel Blake, Annalise Midgley, and myself, Madam Deputy Speaker.
Luke Murphy. Keep it ruler straight now.
Regulators Growth Objective Bill.
Second reading what day?
4th of July.
4th of July. I think the front benches want to quickly swap over. Clerk will now proceed to read the orders of the day.
National Insurance Contributions, Secondary Class 1 Contributions Bill. Consideration of Lord's message.
Now, I must draw the House's attention to the fact that financial privilege is engaged by Lord's Amendments 1B, 5B and 8B. If any of those Lord amendments are agreed to, I will cause the customary entry waiving Commons financial privilege to be entered in the journal. We will begin with the government motion to disagree with Lord's Amendment 1B, which we will consider together with the motions to disagree with Lord's Amendments 5B, 8B and 21B as on the selection paper. I call the Minister to move the motion to disagree with Lord's Amendment 1B. Minister.
Thank you very much, Madam Deputy Speaker, and I welcome the opportunity to consider the Lord's new amendments to the National Insurance Contributions Secondary Class Contributions Bill. I would like to start by repeating my thanks to members of both Houses for their careful scrutiny and consideration of this bill. During this bill's consideration in the other place, 4 new amendments have been made, which we will seek to address here today. As I reminded honourable members last week, Madam Deputy Speaker, when we entered government, we inherited a fiscal situation that was completely unsustainable. We have had to take difficult but necessary decisions to repair the public finances and rebuild our public services. The measures in this bill represent some of the toughest of those decisions. They, and other measures in the budget, have enabled us to restore fiscal responsibility and get public services back on their feet. Yet amendments from the other place before us today put at risk the funding that this bill seeks to raise. So let me be clear again. To support these amendments is also to support higher borrowing, lower spending, or other tax rises. And it is with that in mind that I will now turn to the first group of amendments, specifically Lord's Amendments 1B, 5B, and 8B. Madam Deputy Speaker, these amendments seek to create powers as part of this bill which would exempt certain groups from the changes to employer national insurance rate and threshold in the future. This includes exemptions for care providers, NHS GP practices, NHS commissioned dentists, NHS commissioned pharmacists, charitable providers of health and care, and those providing hospice care from the changes to the employer national insurance rate and threshold. It also includes powers to exempt businesses or organisations with fewer than 25 full-time employees from the changes to the employer national insurance threshold.
Can you give way on that point?
I'll give way.
I thank the Minister for giving way so early in his speech, but I just want to understand very clearly why the government thinks that, rightly in my opinion, the NHS, under the banner of NHS England, should be exempt from national insurance contributions, but other parts of the NHS, such as GP surgeries, dentists, hospice care, shouldn't.
Minister.
Well, Madam Deputy Speaker, as I set out during consideration of Lord's amendments last week, and indeed in pretty much every other stage of consideration of this bill, the response to the changes in employer national insurance contributions that we are undertaking as a government is in line with what his government did in relation to the health and social care levy in the last Parliament, which is namely to provide direct support for public employers. That means central government, local government, public corporations, and that is the standard way in which support for employer national insurance contribution changes is responded to. So, Madam Deputy Speaker, as I've set out, the revenue raised from the measures in this bill will play a critical role in repairing the public finances and rebuilding our public services. Now, clearly, any future changes which would exempt certain groups from paying national insurance would have cost implications. And as I've made clear, that would necessitate higher borrowing, lower spending, or alternative revenue-raising measures. And it's for that reason that I ask the House to support the government's position by disagreeing to Amendments 1B, 5B, and 8B. I'll give way.
Grateful to the honourable gentleman. The Commons' disagreement to Lord's Amendment 1, debated last week, says that the amendment interferes with the public revenue, and the Commons do not offer any further reason. Does the honourable gentleman not think that just perhaps those that we represent would prefer to see their taxed income generously donated, spent upon children's hospices, rather than upon an idiotic deal to spend millions of pounds on the Chagos Islands?
Well, Madam Deputy Speaker, the honourable gentleman, right honourable gentleman, raised the question of hospices during the debate last week on amendments from the other place. And as I made clear at the time, although hospices do not receive support to meet the changes in employer national insurance contributions, we greatly value the work that hospices do. And I pointed to the wider support which the government is giving to the hospice sector, namely the £100 million boost for adult and children's hospices to ensure they have the best physical environment for care, and £26 million revenue to support children and young people's hospices. Of course, he referred as well to people giving to hospices which are established as charities. And of course, the government provides support for charities, including hospices, through the tax regime, which is amongst the most generous in the world, with tax reliefs for charities and their donors worth just over £6 billion for the tax year to April 2024. Now, Madam Deputy Speaker, turning to Amendment 21B, which requires the government to conduct assessments on the economic and sectoral impacts of this bill. As we have discussed previously, the government has already published an assessment of this policy in HMRC's Tax Information and Impact Note. That note sets out that as a result of measures in this bill, around 250,000 employers will see their secondary Class 1 national insurance contributions liability decrease, around 940,000 will see it increase, and around 820,000 employers will see no change. The OBR's economic and fiscal outlook also sets out the expected macroeconomic impact of the changes to employer national insurance contributions on employment growth and inflation. The government and the OBR have therefore already set out the impact of this policy change. The information provided is in line with other tax changes, and the government does not intend to publish further assessments, but we will, of course, continue to monitor the impact of these policies in the usual way. Madam Deputy Speaker, I hope that honourable and right honourable members will understand why we are not supporting these amendments from the other place. The measures in this bill play a crucial role in fixing the public finances and getting public services back on their feet. The amendments from the other place either require information that has already been provided, or do not recognise other policies the government has in place, or most seriously, seek to undermine the funding that this bill will secure. I therefore respectfully propose that this House disagree to these amendments, and I urge all honourable and right honourable members to support the government in making that so.
The question is that this House disagrees with the Lords in their Amendment 1B, and I call the Shadow Minister, Gareth Davies.
Well, thank you very much, Madam Deputy Speaker. I rise on behalf of the official opposition in support of Lords Amendments 1B, 5B, 8B and 21B. It feels like only last week that we were all here, but it is clear that our colleagues in the other place feel as strongly as we on this side of the House do about these amendments, because they return them to us with a similar aim once again. Lords Amendments 1B, 5B and 8B seek to address two of the most serious consequences of this bill that should concern and unite all of us. That a rise in secondary Class 1 national insurance could lead to a significant reduction in health and social care services, including our hospices, hitting the most vulnerable in our society, and represent a complete hammer blow to the future aspirations and very survival of small businesses throughout the country. We all know that the Chancellor has an addiction to creating fiscal black holes. First, she started with a fictional black hole discredited by the OBR, made up as an excuse for her manifesto-breaking tax rises. And this has led to more black holes. Only this time, they are very real because they are being felt out there in the real economy. This bill before us today will create black holes in the finances of hospices, GP practices, farms, fruit shops, butchers, bakeries, and businesses of all shapes and sizes, but especially the very smallest. Of course.
Does he, like me, find it puzzling that on one hand the NHS will be exempt from these changes, and yet many of the services which are, people depend upon for their health, dental services, the social care, etc., will be hit by these national insurance contributions, and therefore those services will be affected, and people will find that they don't experience the health care that they require.
It's rare that questions come with a musical accompaniment, but it made for a great effect, I have to say. But his point is the right one, which is that whether it was intended or not intended, the rationale, one of the pieces of rationale for this bill is to protect, in their words, public services, to bolster public services, if I'm being generous. But the fact is that they're taxing public services that we all rely on, and he is absolutely right to emphasise that. Lords Amendments 1B and 5B seek to provide the power to exempt from both prongs of attack of the Chancellor's jobs tax. This includes care providers, NHS GP practices, NHS commissioned dentists, NHS commissioned pharmacies, and charitable providers of health and social care, such as hospices. And it's hospices specifically I want to speak more about today, because hospices in particular are there for what many will be the hardest moments of their lives. They provide vital physical and emotional support to individuals who are coming towards the final chapter of their lives and for their loved ones. In short, hospices are there to look after us at our most difficult time. So whether through funding, charitable donations, or through legislation, they deserve our utmost support to continue in this task. However, as I set out at committee stage, this disastrous jobs tax will cost hospices up to £30 million just next year alone. Hospice UK has repeatedly warned this government that the bill risks a reduction in hospice services, which will only lead to even greater pressure on NHS palliative care services. Madam Deputy Speaker, of the more than 200 hospices across our country, around 40 provide care for children. These are children who are living with terminal illness, many with all too limited time left in this world. The organisation Together for Short Lives estimate that the decision by the Labour government to raise national insurance will add almost £5 million to the annual cost of providing care for seriously ill children and their families. Let's be clear. This will mean that every children's hospice in England alone will need to spend an average of £140,000 more just to maintain services for the children in their care, after paying the additional tax that this bill will impose. The government cannot seriously be demanding that staff and volunteers at charitable children's hospices, the very people who already give their heart and soul to look after sick and dying children, fundraise their share of £5 million next year alone just to keep their lights on and their doors open. At Treasury oral questions on the 21st of January, the Chancellor stated in response to an excellent question from my Lincolnshire colleague, the Right Honourable Member for Gainsborough, that the settlement for hospices announced by the Health Secretary just before Christmas includes money to specifically compensate hospices for the national insurance increase. This is not correct. And I'm pleased, at least, that this Minister has tried to acknowledge that point. Of course.
Precisely on that point, because I raised this with the Chancellor. When I visited St Barnabas Hospice in Lincoln, much loved place, giving excellent palliative care, they told me they're losing £300,000 a year. In all this debate on assisted dying, we're all agreed that we want more palliative care. I just cannot understand the logic of what the government is doing, and I make one last appeal to them to not load this extra cost on hospices.
Well, my right honourable friend has raised this, I think, at every single opportunity he's been afforded, and he is right to stand up, not just for St Barnabas, but for all hospices. But that one in particular, I have to say, holds a particular place in the heart of people in Lincolnshire. I know as a Lincolnshire Member of Parliament, it's been around for 40 years, it employs 300 staff, and it treats more than 12,000 people across our county every single year. The fact that they're going to be hit with a multiple hundreds of thousands pounds cost for no reason, no good reason, is unacceptable. And I pay tribute to my right honourable friend, Father of the House, for raising this so consistently. I hope the government listens to him. The settlement announced does not compensate St Barnabas for the damage that they're doing, nor any hospice, not least because we know that much of this money cannot be spent on facing down the additional running costs that this tax hike will bring. Because the £100 million capital funding set aside for buildings and equipment. Of course, while this funding is welcome, it will not fill the national insurance black hole the Chancellor has created for the hospice sector, and she should not suggest otherwise. So today, the government has a chance to exempt hospices and other key areas of our health and social care sector from this tax hike by accepting Lord's Amendments 1B and 5B. Madam Deputy Speaker, in addition, Lord's Amendment 8B seeks to provide the power to exempt the smallest businesses, those with fewer than 25 full-time employees from the proposed cut to the threshold at which an employer is required to pay secondary class 1 national insurance. The Chancellor has spoken a lot about growth, but one of the reasons growth has been consistently downgraded since she took office is because we know on this side as Conservatives, and she doesn't as a socialist, that economic growth cannot come from the floor of this House of Commons. It comes from the factory floors and the bustling high street shop floors in each of our constituencies. It doesn't come from state-created quangos like GB Energy. It comes from individuals who had an idea, stuck it out, made it work and saw it through. It comes from people in this country who, by seeking a better life through enterprise, creates the jobs and services that make our country strong. These small businesses are being hammered, not just with the national insurance hike, but in less than a year they have already seen business rates relief cut from 75% to 40%, aspiration penalised with changes to business property relief, and crippling new red tape through the Employment Rights Bill, adding a staggering £5 billion in additional cost. This is a potent and damaging combination of costs that many fear will mark the end. Lord's Amendment 8B gives the government another chance today to change their approach, to throw our small businesses a lifeline, a chance of survival. Finally, Madam Deputy Speaker, while our smallest businesses require specific attention, I made clear last week that this bill sadly does not discriminate. It will hit business groups of all types, across all sectors, in all parts of our country, from charities to cafes, from pharmacies to children's nurseries and send transport. We must understand the impact this bill will have. That's why Lord's Amendment 21B requires the Chancellor to carry out a review of the impact of this bill within 6 months on a range of sectors of our economy, and I urge members to support it. Madam Deputy Speaker, tomorrow the Chancellor will come to this House to launch her latest attempt to reverse as much of the damage of her Halloween budget of horrors as possible. Despite the hopes and dreams of business owners and workers across the country, we can be sure that her emergency budget will not include scrapping this awful bill. It is incumbent on all of us in this place to work to protect and support the most vulnerable in our society and to take decisions that drive growth, backing the very people out there who make it happen. But these are the people who will be hit hardest by this bill. The government must change course.
For the Liberal Democrat spokesperson, Daisy Cooper.
Thank you, Madam Deputy Speaker. I rise to speak to Lord's Amendments 1B, 5B, 8B and 21B. Even before the budget, Madam Deputy Speaker, there were rumours that the government was thinking of introducing a national insurance contribution hike. And we Liberal Democrats issued a stark warning to the government. We challenged them at PMQs and deputy PMQs that if they went ahead and introduced these changes, then social care providers up and down the land would be hit incredibly hard. So the government cannot say that they were not warned. We did warn them, Madam Deputy Speaker, even before they made that announcement. But in these long debates and these many debates we've had in this chamber since the budget, we have consistently made the case that health and care providers should be exempted. The fact is, Madam Deputy Speaker, that the government says that they want to make the National Health Service a neighbourhood health service. We heard it just an hour ago from the Secretary of State for Health and Social Care. They've also said that they want to take services out of hospitals and onto the high street. But this particular tax hammers those very providers that provide the neighbourhood community services upon which the NHS relies. GPs and dentists and pharmacists and hospitals and care providers. They are the providers that hold our community care up and that prop up our NHS so it does not fall over. Government ministers have said on many occasions that they have increased funding to social care, but we know that the additional funding announced in the budget is dwarfed by the rise in the national insurance contribution hike. Similarly, as other members have highlighted, the government says it has given more funding to hospices, but that funding is for capital projects. And Madam Deputy Speaker, there is no point in having another hospice building or another hospice bed if there are no staff to look after the people who are lying in them. Madam Deputy Speaker, we know that we have to fix the front door to the NHS with our GPs and our dentists. We have to fix the back door to our NHS with social care too. But on the point of hospices, we know that there is nowhere else for these people to go. People are looking for support from hospices so that they can die in dignity, with independence, in a setting of their choosing, surrounded by their loved ones, not in the sterile environment of a hospital ward, or worse, a corridor that is busy or an ambulance parked outside. Madam Deputy Speaker, we need our GPs and our dentists and our hospices and our pharmacists and our care providers to survive and thrive if we are to end the crisis in our NHS. The Lords, that are the place in their wisdom, have not sent back the same amendment to ask for an exemption. In fact, they've put a very clever tweak in this amendment. It is simply asking that the government adopts a power, a Henry VIII power, which is not something we Liberal Democrats would normally support. But on this occasion, it would give the Minister the power to choose if and when they wanted to exempt these health and care providers. So when we get enormous growth in our economy, and when we see the success at some point in the future, which we all hope to see, when there is growth is booming in our economy, at that point, a minister could choose at any point to decide to exempt health and care providers, to give them the cash injection that they need. And so I urge ministers and I urge the government to support it. Madam Deputy Speaker, Amendment 8B would provide an exemption or a power to exempt small businesses. We know that small businesses are the engine of our economy. They are the engine of growth. They are the very organisations that prop up our high streets, and they are the glue that hold our communities together. The government has raised the employment allowance for micro businesses, but they have not done so and made other provisions in place to support small businesses. We know that our small businesses can be the engine of growth, but they are screaming out about the amount of obligations that are being put on them right now, with the NICS changes, business rates bills going up, and new obligations from the employment bill. They say that it's all happening at once, and they are overwhelmed. This particular amendment would give the government the power to exempt those small businesses. And Madam Deputy Speaker, I would also speak in favour of Lord's Amendment 21B, which is about an impact assessment. We know, as the government ministers remind us, that there is a sort of tax and spend announcement. But looking at the impact of these provisions, it's more about tax and spend. It's about the overwhelming impact on small businesses who are really struggling right now. Many still have their COVID loans, many of them struggling with access to finance, many of them mortgaging their homes to prop up a new business, and this has come out of the blue. They have not been able to plan ahead for this change, and many of them really fear what's going to happen. And I fear, Madam Deputy Speaker, that if this goes ahead, in a matter of days we will start to see shop fronts boarded up on our high streets up and down the land. Thank you.
I was going to call Sir Roger Gale, but he's no longer bobbing. Sir Roger Gale.
Thank you, Madam Deputy Speaker. I naively assumed that, having been called already twice today, I had to take my place in the pecking order. I do want to come back very briefly to the issue of hospices. This is a very, very serious issue, and I don't think that the Minister or the Government actually understand the deleterious effect that this is going to have upon care, both in adult hospices and in children's hospices, for some of the sickest people in the land. I've listened very carefully, twice now, to the Minister's responses about giving this, giving that, but the point about this is that they are giving with one hand and taking away more with the other. And the net result is going to be a reduction in staff, because this is a tax, a straightforward tax on jobs. And without the people, the dedicated, caring staff that do the jobs that, frankly, most of us wouldn't begin to know how to do, the service will not function. And the children in Demelza House and serviced by Demelza House and Shooting Star and all of the other children's hospices, and then the Pilgrims hospices in Thanet and in Canterbury, will not be able to recruit to afford to pay the staff that they need. This is an integral part of the health service. And the point has been made by the Father of the House and by others over and over again, but because this is the part of the health service, it should be treated as part of the health service in precisely the same manner as the NHS for these purposes. And my honourable friend says my right honourable friend says from a sedentary position, where are the Labour MPs? And the answer, of course, is they will be there in the voting lobby, voting against these measures, but they're not here listening to the debate. And it saddens me to have to say this, but I actually believe that in this instance, their absence speaks volumes. And quite simply, they don't care.
Thank you, Madam Chair. These Lords' amendments seek to address a clear, present and insurmountable financial challenge for significant elements of social health and care delivery in all of our communities. Social care providers, GPs, dentists and pharmacies, the government says in the most spurious and disingenuous way, as though they don't understand the role that they fulfil within the health service, that these are contractors. Well, their basis under HMRC is irrelevant. It is the role that they fulfil in our society and in the delivery of care, health and social care services that's at stake. These are not contractors that can go and develop new markets somewhere else. Their market is exclusively within the NHS and within health and social care, up and down these islands. So the idea that they, like some other business, and many properly commercial businesses won't manage to pivot their way out of this one, but GP practices, pharmacies and care providers and nurseries and hospices certainly won't manage to pivot their way out of this attack from Labour. I want to mention, Madam Deputy Speaker, hospices in particular. When Macmillan Cancer Care speak, doesn't matter what colour your rosette is, you should listen. We should all listen to when they speak, and they have highlighted clearly what this means for end-of-life care. And if I think to myself, over the last 15 years of chaos in the United Kingdom, most of it economic, if I think of the lost decade of Brexit and the catastrophic effect on the UK's economy and the material welfare of people up and down these islands, and I think, who can we blame? Who is culpable? Who has got their fingerprints all over it? Well, I'll tell you something, Madam Deputy Speaker. It's not terminally ill children in hospices who will suffer a debilitating effect on the care that they are provided with as a result of this bill. And the Minister and his government could do a very simple thing to give them a derogation from the grasping hand of this bill and protect children in the worst of all imaginable circumstances. If you look at what the government has done, their fiscal misadventure from the outset has been met with opprobrium from all manner of sections of the economy and society. But they've held firm, and to pay tribute to the Minister, he fronts up here every time with a smile, and he does his best to defend what he's got to defend. And that's his job, and I don't judge him for that. But the bottom line is the government has yielded, not to children in hospitals, not to people trying to deliver social care to get our hospital beds free from delayed discharge. They've yielded to the bankers to restore their bonuses, and they've yielded to the non-DOMs who want all the benefits of living in this country but don't want to pay for it. And I think that speaks volumes about what a Labour government in this day and age is all about. But the real... I will give way.
Madam Deputy Speaker, I hope that I can have this intervention without the musical interlude as well, and I apologise to you for not having a phone. Would you accept that not only are services likely to be affected by this, as he's outlined, but also the aim that the government has in raising additional revenue is going to be affected as well? They've given in, as he has pointed out, to the bankers and non-DOMs because of the fear of losing revenue, but anecdotally, we know now that many businesses, whether it's in supporting the National Health Service or small businesses, are going to cut back on the amount of staff that they can employ because they can't afford to do it, and therefore there could be a loss of national insurance contributions and tax contributions. So this could be an own goal for the government insofar as they put on pain on the businesses, but they don't actually get any revenue from it.
I agree entirely. This is a £24 billion fiscal drag that's intended to create growth. Work that one out if you can, Madam Deputy Speaker, because it's beyond my ken. So, and I'll tell you why they won't make these derogations to key elements of health and social care, because the £24 billion drag, as the honourable member points out, on the economy is already, after compensations, down to £10 billion. If they compensated people that they definitely should, such as GPs, pharmacies, care providers and hospices, that would take them down to somewhere around about £7 or £8 billion. What type of Chancellor, what type of Treasury orthodoxy says we place a £24 billion burden on the economy in exchange for an £8 billion return for the Treasury? It's absolutely catastrophic. It's misadventure writ large, and it's got Labour as its logo. Yes, I will.
I'm grateful to the honourable member for giving way. He highlighted the fact that highlighted the OBR comment saying that the 25 billion is in fact only 10 billion once you account for behaviour change. And if you were to agree, if the government were to agree to this exemption, it could be only 8 billion. Does he agree with me? There are much fairer ways of raising that revenue, including, for example, by raising the digital services tax on the big online media giants and on the big gaming companies as well.
She raises two excellent examples of what could be done in a just way, Madam Deputy Speaker, to raise the funding that they need. And don't let's forget, they knew fine what they were walking into when they won the election. We told them, the Liberal Democrats told them, the media told them, Tories were a bit quiet on the issue, right enough. But we told them there was an £18 billion black hole if they stuck to Tory spending, tax and spending policies. So this is on them. But she mentions two principal examples, which are an excellent and just way to raise funding. They could similarly introduce Scottish income tax thresholds to the whole of the UK, giving most people a pay cut and raising 16 billion into the bargain, or they could raise 40 billion from a 1% on assets over 10 million wealth tax, and there are a range of others as well. 30 billion by rejoining the single market. Not very many people in here talk about that, Madam Deputy Speaker. And they persist in their tendentious references to additional funding, all of which is capital, none of which can soften the blow of the measures contained within this bill. So that's why they don't want to support in particular Lord's Amendment 21B, because they would rather continue to cloak the effect that this will have on care services and on contractorised elements of the National Health Service up and down these islands, and the effect that it will have on the real economy, which Labour are strangers to. Thank you, Madam Deputy Speaker.
Mayhew. Mr. Speaker, I'm just flummoxed by the approach of the government in relation to this bill. We know that Clause 1 raises national insurance employers' national insurance from 13.8% to 15%, and almost more damagingly, Clause 2 raises the threshold, or rather reduces the threshold at which you start paying that from £9,100 to just £5,000. And the government knows how damaging this measure is for healthcare. We can see that because they've taken action to exempt the NHS from it, and it's going to cost billions of pounds because healthcare providers can't just diversify as other sections of the economy can, if they can. They can't raise prices if you're a general practitioner. Your customer is the state, and that is fixed by the Treasury. And the government knows, as a result of that, exactly what the impact of this proposal is on hospices as well. Without an exemption, we've already heard that they're going to have to face an additional £30 million of costs every year as a result of these changes. Now, I have to say, Madam Deputy Speaker, when the bill was first announced, I assumed that there'd been an oversight by the Treasury and that during the course of the procedure of the bill, that would be addressed. But the Lords, both last week and this week, have moved to fix what was originally considered to be perhaps an oversight. But the decision today in seeking to reverse Lord's Amendments 1B and 5B in particular demonstrates beyond doubt that it is now clear this isn't an oversight. This is a deliberate decision taken by Labour to penalise hospices, the care of the dying, and to do what with that money? Because we may be in the obscene position in a few weeks' time of funding for state-assisted dying being taken from taxing palliative care. Madness. This is madness. This is absolute madness. And if you wanted any other reason why you should not be supporting the government, then that is an overwhelming one. And I make one last reference, Madam Deputy Speaker, to the emptiness of the benches opposite. There are now 2 members of the government benches who are not required to be sitting there today. And one, in fact, I take it back, there is only one. That indicates to me, Madam Deputy Speaker, that Labour members do not want to be associated with this. They're going to scurry through the lobbies later, but they aren't brave enough to stand up and defend the decision of their government.
Greg.
Thank you very much, Madam Deputy Speaker. And I know, Madam Deputy Speaker, you don't need any convincing of this, but were you to, the amendments that the Lords have put forward today demonstrate why we need a House of Lords, because they are the ones standing up and delivering the amendments that this government are trying to wriggle out of this afternoon. Amendments 1B and 5B, which the government is trying to derogate from, are absolutely essential for our care services. The financial strain that the government's national insurance contributions are going to put on the social and care sectors is astronomical. Some predictions are around £2.4 billion on social care alone. And that will ultimately lead to reductions in services and, of course, unfortunately, closures, especially around the hospice sector. And the Minister has repeated what he has repeated on many, many occasions, and other government ministers have mentioned, that they are giving a certain amount of money to the hospice sector. But as colleagues on this side have already stated, that is capital spending, and what they vitally need, what they desperately need, is revenue spending to cover the cost that the national insurance contributions are doing. I'm happy to give way.
Gentlemen, is he concerned that one of the key elements of fiscal policy that the government patently don't understand is whole system cost? Because when these care providers, whether they're hospices, in-home care providers or social care providers, when they fall over as a result of these measures, as they will, those costs will get picked up by the rest of the system and it will have a net cost to the Treasury. The
gentleman makes an absolutely excellent point, and one that has been made on numerous occasions on this side of the House. I have to say to the honourable gentleman, it doesn't surprise me that the Labour benches don't understand the economy. What I did hope they understand is the care sector, and the care sector has been telling them time and again that this national insurance increase will hit the sector disproportionately and cause them to reduce and indeed close services. I think of Phyllis Tuckwell Hospice in my constituency in the centre of Farnham, which is fortunately going through a multi-million-pound rebuild as we speak. But when it opens, reopens, it is going to be hit by these national insurance contributions and will have to make decisions about what services it can provide to my constituency and the surrounding areas of Surrey and north parts of Hampshire. And likewise, Madam Deputy Speaker, on Friday I'm going to go and see Shooting Star Children's Hospice, a fabulous children's hospice that I visited on a number of occasions. And what is galling to me is I see photographs of Labour members turning up to Shooting Star and similar hospices, putting their arms around them and saying what a wonderful job they're doing, and that later today will walk through the division lobby to take money away from them. What hypocrisy, Madam Deputy Speaker. And we already know that there are workforce challenges in the care sector, especially in the hospice sector. So why on earth is the government targeting these sectors to be able to raise the national insurance contributions from? And of course, as honourable members on this side have mentioned, this isn't an abstract cost. It isn't a cost that is going to hit some sort of nebulous business. This is cost that is going to hit patients and indeed in the hospice sector, those who are dying because care will be taken from them. It is a tax on community care. It is a tax on dying, and the Labour government should be ashamed that it is bringing this through. Yes, of course.
I'm most grateful. We've concentrated a very great deal on the children's hospices particularly, and rightly. And I still hope and believe that at the 11th hour maybe the government will have some compassion as a socialist government and give some ground. But the other area that we haven't really touched on enough is the independent care providers who are providing services in people's homes, because they are not able now to employ the people that they need if they can get them. That means inevitably that those cared for will end up in hospital at still greater cost to the health service.
Well, absolutely. My right honourable friend makes an excellent point, one that was echoed earlier from the SNP benches. And it is absolutely correct. There will inevitably be a net cost to the Exchequer because of this policy. And he's absolutely right that home care is something that we haven't touched on but will be affected. I have home care companies in my constituency that will not be able to expand their staff, which they vitally need in order to meet the needs of people in my constituency. Again, we haven't really touched on it a lot, but pharmacies as well are in this same position. I visited Badgers Wood Pharmacy in Headley in my constituency a few weeks back, and they were saying that this is going to hit them absolutely really, really hard, and it's going to have a real problem on the amount of service that they can deliver for my constituents. Madam Deputy Speaker, not only is it going to have a massive effect on the businesses themselves, on the GPs, on the pharmacies, on the hospice sector, on the home care sector, not only will it have a massive impact on the economy because there will be a net cost, not only will it have a massive impact on patients because they will not receive the services within the wider NHS family that they deserve, but also it runs entirely contrary to the government's stated policy that it wants to bring healthcare close to home, close to the community. So whilst it's exempting acute care, hospital care, away from community, the bit it says that it actually wants to expand, it's taxing. It's totally illogical, even on the government's own policy. So, Madam Deputy Speaker, I hope that the government does have a 11th hour change of heart, either today or the emergency budget tomorrow, because it is vital that we support these sectors. And Madam Deputy Speaker, Lord's Amendment 21B, I think, is the proof of the pudding which is in the eating, as it were. If this government was so convinced that its policy on this was the right, just, fair and proper one, it would allow a review to go ahead so we could see the impact. The fact that they will be walking through the division lobbies later to hide this policy from the British people tells you all you need to know. They know this policy doesn't stand up to scrutiny, and they're running from it.
The Minister will do some wind-up. Minister James.
Thank you, Madam Deputy Speaker. With leave of the House, I'll respond briefly to some of the comments made by members of the opposition parties during the course of this debate. Madam Deputy Speaker, although the spokesperson for the Liberal Democrats, I feel, is not going to support us in this bill, I do nonetheless recognise that she seems to support the extra funding that we put into public services in terms of GPs, dentists, hospices where they're commissioned by the NHS and so on. And although she won't agree with our difficult decision that we've taken to raise that funding, I feel I got the impression that she supports our spending on those public services. In terms of the members of the official opposition, Madam Deputy Speaker, the government spokesperson, the shadow minister, claimed that very small businesses will feel the greatest impact from the changes in this bill. But I therefore can only conclude he's not read the bill, because he would have seen that we are doubling the employment allowance, therefore giving a £10,500 allowance, meaning that the very smallest businesses will not pay any national insurance contributions at all when they're employing up to 4 people earning the national living wage. And more widely, Madam Deputy Speaker, the Shadow Minister and so many of his colleagues on the opposition benches seem firstly to refuse to take any responsibility whatever for the state of the public finances or the public services after 14 years of the party opposite being in control. But they also, Madam Deputy Speaker, seemed to resist the opportunity to acknowledge that the approach that we are taking in government to compensating the public sector for changes in employer national insurance contributions are the same as the previous government took in terms of the health and social care levy. This came up time and again, and even when the Shadow Minister was intervened on by another member on the opposite side, he seemed again to miss that opportunity to acknowledge that it is exactly the same approach that we are taking that he took and his colleagues took when they were in government. Madam Deputy Speaker, the amendments that we have been debating today from the other place require information that has already been provided. They do not recognise other policies the government has in place, or, most seriously, they seek to undermine the funding this bill will secure. So let me be clear. To support these amendments, the amendments here that create exemptions, is also to support higher borrowing, lower spending, or other tax rises, and I therefore ask the House to support the government's position by disagreeing to Lord's Amendments 1B, 5B, 8B and 21B.
The question is that this House disagrees with the Lords in their Amendment 1B. As many of their opinions say aye. Aye. Of the contrary, no. No! Is as on the order paper. As many of that opinion say aye. Aye. Contrary, no. No. The tellers for the ayes are Christian Wakeford and Keir Mather, and the tellers for the noes are Katie Lamb and Jerome Mayhew.